The district maternal scheme Matryoti has proved to be a great tool in improving the district MMR. Through Matryoti, 4 free ultrasounds and other tests are provided for each pregnant woman in the district. The frontline functionaries like ASHA and Anganwadi workers play a crucial role in successfully implementing this program. To improve the conditions further, the administration can raise awareness about importance of maternal health care and train more ASHA workers to serve under Matryoti scheme.
The health status of children under the age of 5 years is poor in the district. A part of the revenue generated from the cess levied on mine companies should provide basic health amenities like lactogen, baby diapers, milk powders, and other nutrition and sanitation products for children under 5. AWC workers are trained to spread awareness among the nursing mothers about their children's proper health and nutrition. To facilitate a thorough understanding, the government should set up community centers equipped with appropriate digital equipment such as television, projectors, etc. Hospitals should also ensure regular maintenance of healthcare equipment such as incubators. Also, the PHCs should be provided with proper power backup equipment. There have been cases of rent seeking in Anganwadi Kendras. Geotagging can be used for strict monitoring of such essential supplies. Maternity leave should be extended from third trimester of the conception to 26 months after the child's birth to ensure a proper health and well-being of mother and the child.
The most common diseases in Sundargarh are chronic ailments like TB and water and vector-borne diseases like jaundice and malaria. The TB prevalence is 280 per 1 lakh people in rural areas, which is much higher than the national average of 195 per 1 lakh people. The majority of poor and tribal population has no adequate access to the public healthcare and safe drinking water. Now, the affected people should be mapped and followed up at the community level. Patients who are homeless and living on the street should be rehabilitated in government facilities. Rapid tests can be done, diseases should be detected early, and the best treatment should be provided free of cost. Free weekly transportation facilities to the health centers should be provided in every tribal area. Defense Research Laboratory DRL of DRDO has developed various products of water purification, waste management, personal protection, a water testing kit for water quality assessment, and a fungal detection kit for diagnostic of bacterial contaminants. The service of DRL may be taken for making clean water accessible to the poor and tribal population of the district, and funds for the same should be sourced from government, industries, and NGOs.
Type 2 diabetes remain a significant concern in the district. It is primarily due to the late diagnosis of the disease. Weekly camps should be set up in hospitals or other suitable places where people can get free or subsidized blood and urine checkups so that diabetes can be detected early and the complications can be prevented or delayed. All government schools should have counselors for mental health wellness.
It would be effective mapping of vulnerable areas through intensive field-based surveys, case identifications, anthropometric and sociometric procedures, drug demand and drug abuse hotspots, active participant mapping strategies of the IRCAs, fact-finding groups, and so on. Alcohol consumption is deeply embedded in the daily rituals of indigenous tribal women. To address this issue, community counseling utilizing platforms of RMCHA and VHND could be ideal. A well-designed culture-based intervention encompassing the alcohol researchers, mental health specialists, public health workers, and anthropologists is necessary. Specific and specialized intervention programs, self-report and screening measures, early identification and early intervention approaches could be beneficial. As per the reports, the fatality rate in road accidents in Odisha is 33.33% higher than the national average. While 48 die in every 100 road accidents in Odisha, The national average is 36. A few suggestions to reduce the risk of road accidents are as follows. A rapid response team composed of health professionals and vehicle experts should be set up in different parts of the district. Bharatmala project is still not implemented in Sundargarh district. Implementing it will also resolve the traffic issues as there is too much movement due to mining industries. Also, it will provide an opportunity to use safe and quality roads for common people. Vehicles should be star rated according to the safety measures provided. Improve the driver license and training system to improve the competence and capability of the drivers.
The tribal people in Sundargarh refrain from using modern contraceptive methods due to their many superstitions. Counseling community heads and young individuals about the benefits of contraceptive methods and the adverse effect of consecutive pregnancies will help create awareness. Spacing and surgical methods like IUCD and minilab tubectomy have lower failure rates. The government should provide these services for free in district hospitals and extend these services to primary health centers. Sex education programs should be included in school curriculum.
Universal health coverage has not been successfully achieved in the Sundargarh district. Sundargarh lacks health infrastructure and healthcare personnel by almost 50% of the norms and requirements. Poor accessibility to the healthcare facilities is also one of the major concerns. Although there are provisions for mobile health units, these are not accessible to the people in certain areas due to lack of infrastructure. We should improve connectivity to these locations with challenging terrains. The proportion of people with disabilities is also high in the district. District disability rehab centers, vocational rehab centers and rural rehab extension centers should be set up. The health status of tribal communities in the district is very poor. Cultural barriers might be one of the reasons for tribal communities not availing health benefits. We can disseminate health messages using live performances like dance or plays to appeal tribal populations. Approving traditional healthcare methods indigenous to the tribal communities in the public healthcare centers might help make health service more accessible.
According to government reports, the number of chemical producing factories is 301 in number. Beldihi village in Sundargarh district is one of India's most chemically contaminated sites. Continuous Emission Monitoring System (CEMS) and Continuous Effluent Quality Monitoring Systems (CQMS) should be mandatory in industries, and the norms should be established. If found violating, warnings should be issued, followed by fines and a temporary shutdown. The Comprehensive Environmental Pollution Index should be used to categorize industrial clusters. Critically polluted areas must be banned from new industrial setup and expansion. The government should promote the use of green and sustainable technology by subsidizing it. It will help reduce harmful emissions from various industries which lead to contamination and health complications. Organic fertilizers should be promoted and chemical fertilizers should be reduced.